Pulmonary embolism, commonly referred to as PE, is a life-threatening disease that is caused by a blockage in the artery of a lung.
Pulmonary embolism affects roughly 300 to 600,000 people in the U.S. every year and is estimated to result in 5 to 10% of hospital deaths in the U.S. and is the leading cause of cardiovascular mortality. Causes of pulmonary embolism. Here we have a normal vein with blood flow going at a normal rate. And here they start to collect and clot together, creating an embolism or a blood clot. Chest radiographs are important in the examination process of a PE to observe the size and shape of the heart and lungs, since PE affects the respiratory system. By studying the heart and lungs in a chest radiograph, radiologists are able to see if any fluid is surrounding the lungs, causing a pleural effusion, or if there is an enlargement of the vessels of the heart. Chest radiographs are usually the first step in the diagnosis process of a PE. In nuclear medicine, abnormal tissues show up on camera because they metabolize at a different rate than normal tissues. Since nuclear medicine shows the function of the organs and vessels in the body, a lung ventilation perfusion scintigraphy scan can be a valuable tool in the diagnosis of PE. This scan uses radioactive isotopes in venous form to show how well oxygen and blood are flowing in the lungs in order to detect PE. Diagnostic medical sonography is a non-invasive procedure that is very safe for a patient. Sonography uses high-frequency sound waves to produce echoes within the body, and therefore no radiation exposure is involved in this modality. The strength and timing of these echoes are what get interpreted by the computer and produce the graphic image. Inducer or Doppler is placed over the body part in which the patient is being imaged, and a real-time image is produced on a computer screen. In Doppler ultrasound, it is a form of sonography that can detect and measure the speed and direction of blood flow. Doppler ultrasounds of the lower legs are important in ruling out the possibility of deep venous blood clot, which can cause a PE. Since the majority of emboli are formed within the blood clots of the veins in the legs, ultrasounds of the legs are very sufficient in confirming embolus. Sonography, also referred to as CT, is an important modality in the diagnosis of PE, as it allows for clarity and detail of anatomy through image reconstruction. In CT, X-rays pass through a patient 360 degrees around the body and attenuate detectors, which are inside the gantry of a scanner. It is this part that rotates around the patient's body during the scanning process, and is what makes CT such an important factor in pulmonary embolism diagnosis. CT has the upper hand when it comes to the diagnosis of PE because it has the ability to reconstruct the body's anatomy into a 3D form, which is particularly valuable when trying to gain visualization of the small vessels in the lungs and the heart. Magnetic resonance imaging, or MRI, is another non-invasive diagnostic tool used to diagnose PE. MRI consists of a powerful magnetic field and a radio frequency that combine to produce a radio signal in the body and process electronically to produce images on a computer monitor. MRI is one of the least likely to be used in the diagnosis, however, because of the poor performance in suspecting PEs. Treatments for PE include anticoagulants, ECG, oxygen saturation, and monitoring of vital signs. Anticoagulation therapy should be given to those with PE and active cancer. With prompt treatment, the outlook for a full recovery is good with most patients. However, since PE is so difficult to detect, sudden death may occur.